Assalamu alaikum, good evening, and namaste to all the Parkinson's heroes and their families. Today is World Brain Day, and this year the theme of World Brain Day is Parkinson's disease awareness. How we will end Parkinson's disease. That's the campaign we have for the World Brain Day this year. Myself, Dr. Shivam Mittal, I'm a neurologist, consultant neurologist at Cleveland Clinic, Abu Dhabi. I'm the section head for Parkinson's and movement disorders. I did my training neurology at Cleveland and fellowship in Parkinson's and movement disorders at Yale University and Mayo Clinic, USA. It's been more than 8 years that I've been working on Parkinson's disease, and that's my area of interest and passion. And here I am with my colleague, Dr. Tanmoy Maiti, who is a neurosurgeon, and we will introduce him later. This is a team at Cleveland Clinic, Abu Dhabi. We have a team of neurologists, neurosurgeons. We have a team of psychiatrists, physical therapists, speech therapists. This is a patient-centric care. You are at the center of the focus, and we all are around you to make life easier for you. I want to start with a very basic question. What is Parkinson's disease? Before coming to that, I want to share that why it is so important for us that World Brain Day has decided to call it as a Parkinson's disease awareness campaign this year. And the reason is the Parkinson's disease numbers are growing each year. By 2040, we are expecting the numbers to double. That's a big number. It's like a pandemic. So this is the need of an hour to wake up and start working on Parkinson's disease and see how we can control it and make it easier for all our patients. Now, many of my patients would know this. I usually give this example in the clinic when they see me in the movement disorders clinic at Cleveland Clinic, that I compare our body to a car. And the example I give is you need proper fueling of the car for the car to move smoothly. The same way our body, the brain has an engine, and the engine is called basal ganglia. This requires a fuel which is called the dopamine. When the fuel is in a sufficient quantity, our body moves freely, smoothly. But when the quantity decreases, it causes symptoms of Parkinson's disease. This is an illustration that you can see that there is enough dopamine, enough fueling in the brain. You can see that the body is moving freely. Now, when there's a lack of dopamine in the brain, the body becomes slow, stiff, and you get the symptoms of Parkinson's disease. Everyone knows these famous people. They all had one thing in common. They all had Parkinson's disease. We all know the legendary boxer, Muhammad Ali. He fought with Parkinson's. He raised so much awareness about Parkinson's that we still give his example. And one of his statements that he says, God will not place a burden on man's shoulder knowing that he cannot carry it. These are some very strong words. And this is something that we should understand, that God gave us this condition because we can handle it. We have the ability to do it. And this is what the message I would like to share with all of you. Now, this is an example I want to give that when you meet someone, your family, friend, people around the street, you see the symptoms. And what they see is tremor, slowness. They see decrease in facial expression. They see your changes in the walking, the slowness in walking. But what they don't see are the other symptoms, which I will be discussing later on, which are very common. So I want to start with the first symptom, and videos speak more words than I can explain to you. So I want to show some examples, and you can see how the symptoms of Parkinson's disease looks like. Of course, you know that because you're living with it. You know people who have Parkinson's disease. But this is something I want to tell you as a Parkinson's specialist to see how we grade you. When I see you in the clinic, I say, okay, the tremor is less, the tremor is more, the tremor is much more. And this is how we look at it as per the international guidelines. The other symptom that people can see, that everyone can see, is a slowness in the body movements. This is, in the clinic, we test by tapping your leg, tapping your hand. This is something that many patients think that I'm doing some exercise with them in the clinic, but this is actually, I'm seeing what is the severity or how much is the slowness of the body is affected with Parkinson's disease. I want to come to a myth that many people say that I don't have a tremor, so I don't have Parkinson's disease. I agree. Parkinson's disease, you see mostly tremor, but again, there is another big group of patients who do not have any tremor, but they have symptoms of slowness, stiffness, difficulty in walking. and that is also Parkinson's disease. I will emphasize by showing the video of these two types of Parkinson's disease. So you can see these are very nice patients who have Parkinson's disease for many years, and we can see that these two patients with the white shirt, you can see that he is having a lot of tremor. The patient in this video, you can see there's significant slowness in the walking. So we are seeing here is patient who has a lot of tremor, patient who has difficulty in walking and slowness in walking. Now coming to the symptoms that people cannot see that you are experiencing, and this is something that when you come to the clinic, I will ask you a set of questions. Our team is specialized in this. We deal with all these things and we try to manage you with all these symptoms to make your quality of life better. Number one, which is IMSAC, constipation. The other symptoms are sleep disturbances. Patients will tell me that at night they have a lot of cramping, a lot of pain in the legs, difficulty in sleeping because of the pain, also difficulty in moving around, turning over in bed at night because they feel a lot of stiffness and tightness in the muscles. And number three is sometimes the patient's wife or patient's husband, they tell me that at night, doctor, he is talking in his sleep, he would move his arms and legs, he is talking, he would sometimes scream, shout. These all are symptoms of Parkinson's disease. Other symptoms are urine symptoms like urine urgency and frequency, and there are many other symptoms, but other very common symptom is anxiety and low mood symptoms, which is very prevalent as well. And for each and every symptom, we have treatment, we have some medicines, some interventions and a specialist that we can refer to. So this can all be managed. The main thing is to be aware of the symptoms and say this is because of Parkinson's disease. The medicines are working well. At that stage, we say, what is the involvement of Parkinson's? So when the Parkinson's is affecting only one side of the body, we call it stage 1. When it's both sides, we call it stage 2. When the balance starts getting affected, we call it stage 3. But there's a caution here. I would not say a patient is stage 5 if the patient is not on the medicines. If we give the right medicines and is the patient able to stand up and walk, it is not stage 5. Now this is a roadmap. This is a graphic explanation I want to give. When we didn't have the good treatment for Parkinson's, when we don't have the right specialists for treating Parkinson's disease, this is what happens. You are in your 40s, you are in your 50s, you have Parkinson's disease, a new diagnosis, you are good for a few years, then you start getting balance issues, and then you deteriorate and you start having balance issues and you need some help with daily activities. This is with no effective treatment. Now with the effective treatment, we want to improve your active life. We want to stay active as long as you can. Parkinson's disease doesn't shorten your lifespan. It just affects your quality of life. So we try to improve your quality of life as long as we can with the correct therapy. So now coming to the treatment, what are the treatment options available? I do not want to give you too much information that it will be difficult for you to understand. I would just say this is a take-home message. There's one thing you should always do. One thing, which is the medicines. And third thing is the advanced treatment options. So coming to the most important part, exercise. You must have heard me in the clinic. I tell every patient of mine, the goal of the treatment for Parkinson's disease is to keep you active. Activity slows down the progression of Parkinson's disease. I prescribe usually 30 minutes of exercise, 5 days a week. This can be any type of exercise. I see swimming is very common in this area. Swimming is very good. Aqua walking, running, cycling, any kind of walking which makes you feel sweaty, tired, that is very good for Parkinson's disease. I want to show you this video. You can see this patient is having a lot of difficulty in walking. We call it gait freezing. But when you see him cycling, he is a normal man. So what is the take-home message? Cycling, any type of exercise is important. Even if you're freezing of gait, you can do stationary cycle, you can do cycling outside, but under supervision. Now, very important part, speech. Speech is a very common symptom in Parkinson's. Mostly patients do not understand that they have difficulty in talking, but mostly when they are asked by their family, their friends on phone, can you repeat again? Can you repeat again? So we know that my speech is soft. I'm not able to bring it loud. And that is something which gets affected in Parkinson's disease. We have to focus on our sound. If you say, loudly. This is something I do in the clinic. Say la la la. Say ka ka ka. This is something which is something to bring out your speech, and you can speak it loud. You just need a reinforcement, and that is something which we call as a LSVT therapy, which is for the Parkinson's disease patients. And I'm proud to say that at Cleveland Clinic Abu Dhabi, we have a big team of speech therapists who are all LSVT certified in Parkinson's disease treatment. Swimming in Parkinson's is very good. It is very helpful to stay active. Yoga and Tai Chi is actually proven in Parkinson's disease that it can help to improve your balance and your endurance. Now, with the best medical treatment, I want to show you the patient that you saw with the tremor dominant Parkinson's. And you can see that he is having significant tremor. He is having slowness in the movement. Now you can see he has a tremor when he is walking. Also, there is shuffling when he is walking. This is after the medicine. So once you give the fuel to the brain, the symptoms improve. The similar patient that we saw earlier, he had prominent tremor, and just with one dose of the medicine, you can see the tremor is better. Now, many times we see that the medicines are not helping the tremor. We say around 30% patients do not respond to the levodopa medicines or the medicines which are the gold standard medicines for Parkinson's disease. And in those patients, we have to think about advanced treatment options. We think about surgery. We think about other treatment options. I'm going to talk about it. But something less invasive, like a Botox injection, it can also help the hand tremor. And I'm very proud to say that this is something that we started back in US at Yale and at Mayo Clinic. And this is our first randomized study that we published. And all over the world, people are now using this treatment for helping the hand tremor. Another patient that he is very elderly, he cannot tolerate many medicines, he cannot go for DBS surgery or the evaluation. He had a Botox injection for the hand tremor, and you can see he was very happy with the treatment for the hand tremor. Now, this is a very important slide I want to bring your attention to. So you can see in the graph, you can see the graph there, you can see early Parkinson's disease, moderate Parkinson's disease, and advanced Parkinson's disease. So the first phase, we call it honeymoon period. This is like the phase where you just take the medicine, one tablet, 2 times a day, 3 times a day, and your symptoms are under control. There are no fluctuations in your symptoms. That's the best phase, and you want to keep it active as long as you can. In the moderate phase, we see there are some fluctuations. When you take the medicine, you feel the symptoms start improving after half an hour or 1 hour. The symptoms improve for about 3 or 4 or 5 hours. Again, if you don't take your medicine, the effect comes down and you again feel the symptoms. So there's a need to take the medicine, and there are fluctuations that can develop during the daytime. And this is the time that we should not miss the right opportunity. This is the time we can turn the clock back and bring you to what you were 3 or 5 years ago. This is the time that we need to intervene, and you need to see a movement disorder, a Parkinson's specialist, to see how we can improve your symptoms, how we can turn the clock back and try to make you more active, physically more active, do exercise, Tai Chi, yoga, swimming, all these things. So the time when we intervene, we think about advanced treatment options are when you have fluctuations. That is usually 5 years from onset of Parkinson's disease. Number 2, when you have the tremor, which is not responding to the medicines. Or number 3, you are not able to tolerate the medicine. The medicine is causing side effects. At that point, we consider advanced treatment options. Now, coming to the treatment options for advanced treatment, mostly we have discussed about the 2 therapies are the pump therapies and the DBS, or the deep brain stimulation. I will talk about the pump therapies briefly, and then I will invite another speaker, Dr. Tanmoy Maiti, to talk about the DBS. So what is pump therapy? Duopa pump, or the levodopa continuous intestinal gel, or LCIG. And this is we are giving the medicine, the dopamine that you give by mouth, by tablet, you're giving in a more continuous fashion in a form of a gel. And this gel is, you can see the person he is holding in his hand, the cassette, and that pump has that liquid levodopa gel, and this transfuses medicine to your stomach, to your intestine through a PEG tube. So PEG tube is an invasive procedure. Again, we have the tube which goes inside the stomach and it goes into the intestine, and you transfuse the medicine throughout the day through this tube. This is what we call as a Duopa pump. Now, the other pump that is more recent, and this is less invasive than the previous pump, is what we call as apomorphine pump. These pump we use in patients who have fluctuations, who have advanced Parkinson's, whom we cannot go for DBS. These are the patients who cannot get DBS because there are some criteria that if you have these checklists, then only you qualify for DBS. If you don't qualify for DBS, we think about the pump therapies, because still the best treatment available is the DBS. But if you cannot get DBS, the pump therapies is the next option. In the pump therapies, the apomorphine pump is a less invasive. As you can see, there's only a small needle which goes under the skin and it transfuses the medicine called apomorphine, which works like the levodopa medicine and helps to control the symptoms. You carry this small size pump in your pocket, around the neck throughout the day while the pump is infusing the medicine. So now I want you to hear about deep brain stimulation, DBS, and I would like to invite Dr. Tanmoy Maiti. There's a lot to say about Dr. Tanmoy Maiti. He is my colleague. He is a functional neurosurgeon. He is a staff physician at Cleveland Clinic, Abu Dhabi. He has more than 95, around 100 papers published in movement disorders. He has done fellowship at Cleveland Clinic, Mayo Clinic. He is highly qualified, and we are so lucky to have him as a part of the team at Cleveland Clinic, Abu Dhabi. So I welcome Dr. Tanmoy Maiti to talk about deep brain stimulation surgery. And after that, we will have a concluding slide, and we will take all your questions.
Hello everyone, my name is Dr. Tanmoy, and I am the functional neurosurgeon and who does deep brain stimulation surgery. Thanks Fatima, thanks Dr. Shivam for a kind introduction. Whenever we discuss about deep brain stimulation surgery or any brain surgery, it sounds very risky, very dangerous to most of us, right? But I would like to say that deep brain stimulation is no surgery is ever the first line treatment. We think about surgery only when the medicine is not working or causing side effects. The advent of deep brain stimulation and surgery is a revolutionary. It is the most important surgical procedure which have developed over the last 50 years. So we have known about other procedures of surgery like ablative surgery or stem cell surgery, but what we have seen over the last 50 years, no other surgical procedure has given as good result as deep brain stimulation surgery. Another important aspect of deep brain stimulation surgery is it is completely reversible. So say in next 20 years, there is a new medicine which comes for treatment of Parkinson's disease, or a new surgery which comes for Parkinson's disease treatment. We can always take it out or stop the battery and use the next other new treatment without thinking much about it. No other surgeries are mostly a irreversible change, so where we make a irreversible change to your brain. So that doesn't have this same benefit like a deep brain stimulation surgery. We tell this is like a brain pacemaker. This has three parts. One part is the electrode which is going in the brain. The battery or the pulse generator is at your chest, and there is a connector between two. I clearly remember my first patient whom I treated with deep brain stimulation surgery. He had severe tremor and his whole life was debilitated because he was not able to function normally. His daily life was severely impaired. So when I did the DBS surgery in the operative room, when he woke up, I found that the tremor is completely gone. I saw a big smile in his face, and then he started crying. Those cries was out of joy. And then I felt I have done something in my life. So there are three phases of the surgery. The first part, when the patient is sleeping, when the maximum part of the surgery is done, then we wake the patient up briefly for a few minutes to check that his tremor and the rigidity is completely controlled.
Okay.
Once we make sure that he has completely improved, then we make the patient sleep again and complete the surgery. Here you can see on the left side, a patient who was not able to hold a cup before is holding a cup, and we are checking whether he can bring that cup towards his mouth. The other patient, he's a musician. All he wants to play a violin, which he was not able to do since he was diagnosed with Parkinson's disease. Here he is checking whether his fine movement is still intact. And we were very happy to see that a patient went to sleep knowing that everything, all the symptoms are taken care of. A few of you have asked me that what all symptoms DBS can control and what all symptoms DBS cannot, and when to do, when not to do. It's a long discussion. I will be brief here. So DBS can improve your tremor significantly. So you can see here one patient who had a significant tremor before the surgery, and you can see here when we did the surgery, and after the surgery, his tremor is completely controlled. The next question some of you have asked, that whether all patients need deep brain stimulation? No, big no to here. So that is why a team of experts is very important. So we have here, thankfully in CCAD, we have the experts who are specially trained in treating Parkinson's disease patients. So we have a team of doctors, physical therapists, psychologists, and speech therapists. We discuss each and every patient because two patients are never the same. All of them are in different stages of Parkinson's disease who need different treatment. Some of them need only medicine. Some of them need a medicine and surgery. So that's how we discuss all the patients. And then we also discuss with our main campus, which is in Ohio, US. And that's all because we want to give the best care for all of you and each of you. I'm very thankful to CCAD that we have been given an excellent team here. I invite Dr. Shivam back and Dr. Mon.
So you must be wondering why I have this slide, just to show you a few things. What do you observe here? This is just a 10 seconds video, but it took years and years and years of training to get the skills, to get the teamwork quality, to hit the target. So the main importance of this, what you see in this video, is teamwork. Number 2 is the skills. And number 3 is the right timing. If we can get all these 3 things together at one place, and a care that we want to care for the team, that's our goal. We want to win the stream. We want this person to win. That is what we are here for. And that's what something we'll be trying all the time while we are here at Cleveland Clinic Abu Dhabi.